You are watching Access LaPorte County, Channel 97. Coming up next is the July 19th, 2022 meeting of the LaPorte County Board of Health. You can find more information on this meeting by visiting www.accesslaportecounty.org.
I'm Mike, and I call the meeting of the LaPorte County Board of Health, July 19th, 2022, to order. Julie Davis, please, roll call. Present.
Here.
Here.
Thank you. Do you need me to start over? Are we good? Very good. Okay. Mrs. Arnold.
Present.
Dr. Dora.
She said it's not on.
We didn't know. We're technologically challenged. Okay.
You want to take two?
Should we do that?
Let's do two.
Should we do that again so we can hear Jules?
Absolutely.
All right. So
Okay.
we just called the meeting to order. We're getting our mics in order,
We are.
and we're going to do a roll call.
Dr. Uhas.
Present.
Ms. Lawn.
Here.
Mr. Sandy.
Here.
Mrs. Arnold.
Present by Zoom.
Dr. Dora. Dr. Manning Cox. And Dr. Nelson.
Oh, there's Dr. Cox.
There's Dr. Nelson.
There's Dr. Nelson. All right.
Okay. Thank you, ladies and gentlemen. We're good to go.
Thank you very much. All right.
you.
The next item on our agenda is the approval of the board minutes from our last meeting on April 12th, 2022. Do I hear a motion to approve the minutes?
I move that we accept the minutes from the April 12, 2022 meeting.
Is there a second?
I'll second that.
Okay. Any discussion? If not, I will entertain a vote. All in favor of accepting the minutes?
Got to vote. Roll call.
Pardon? Yeah, I know. I all in favor of accepting the minutes from the April meeting. We're going to do roll call because we have somebody on Zoom. So all in favor, please, let's go down the list. Say aye or nay. This is easy because I think we'll all approve the minutes. Mike?
Mike Sandy, yes.
Ollie?
Allie Lawn, yes.
Yeah, just say your name and make a vote, guys.
Okay.
No, up there.
Mark Nelson,
Lauren.
yeah.
Lauren Arnold, yes.
Pat Dora, yes.
Dr. Cox?
Georgetta Manning Cox, yes.
Okay, thank you. That's done. So just so you know, if we make any motion and we take a vote because it's a hybrid meeting, we're going to have to individually vote. We can't just all say, we have to say our name. All right. The next item is public comment. Do we have any public comment today? Public comment going twice. And for the third time, there's no one out there, but I want to be sure no one just walks in at the last minute. So public comment going the third time. Hearing no public comment, we'll go down our list of items to cover today. Health officer report, please.
Oh, thank you. As always, it's COVID first because it's still a huge issue for us, and the numbers are going up, but thank goodness the hospitalizations and deaths are not following the numbers that are going up. We really don't have any good idea of how high the numbers are in a way because, of course, so many people are testing at home and not reporting it. So it's very difficult, but it is certainly suspected that it's much, much higher than what's reported for positive cases. The variant right now is BA.5. It's extremely contagious and it's causing problems for a lot of people. Fortunately, it doesn't seem to be as deadly as some of the other ones have. And of course, we've got better treatments now for people, and more people are vaccinated.
Could I ask you a question at this point? I don't mean to stop.
Yeah.
When you said the new variant, lower the hospitalizations and deaths aren't reflecting it.
I mean, they are up a bit, but not the huge,
Right.
big spikes that we had like in January
Sure.
and that type of thing.
Well, my question is, when you said it's still causing a lot of problems, could you explain a little bit more about what the problems are so that people,
People
don't
are still
think...
getting it, so they're missing work. It's a lot of times it's still the type of problems that is, if you get it, you're off for 5 days, and some people are on their third and fourth round of it. So it's certainly an issue from that point of view. And of course, it's still issues because some people are still dying from it. So.
And they may not be in the hospital, but they might still be symptomatic.
Right.
You know,
But they
fever-
still, if they're positive, they have to
isolate.
isolate, yeah.
Yeah, I just didn't want people to think, well, if it can't be that bad because if people aren't dying, the hospitals aren't overwhelmed.
Well,
No, I think people that
I
get
was
it.
coming to all that.
Pardon?
I said I'm coming to all that.
Okay, perfect. I'll be quiet.
So right now they think that Omicron variant is probably about half of the cases out there that are tested. And again, as we know, we don't really know how many cases are out there. There is another one, the BA 2.75, that's extremely active in a lot of countries. India is particularly suffering because of this one, and the expectation is that will come our way. It does have more illness, more hospitalizations, and more deaths associated with it, at least in other countries. Remains to be seen how it'll affect us here. The other thing that it's important about that too is, of course, because now the decision is being made as to whether a new booster is going to be approved by the FDA. In the meantime, the boosters right now is everybody over 50 can have a second booster. Everybody 12 and over who has an immune compromised issue can be boosted. But there's a lot of other people that are not being boosted. And right now there's a fairly strong debate as to whether everybody should be being offered this booster. Some of the negative thoughts is that if you're 25 and you're healthy, you probably don't need it. Again, that's a little bit above my pay grade from how they're making some of these decisions. But there are also some concerns that people will become immune to the booster. Is that there is an effect that can be is that when you get COVID the next time, your body will only respond to the if it's the same as what you've already had, and they're not sure how much of an issue that is. But that's another reason that they're debating whether the second one should be given to everyone, because of course there's also the new one coming out, and the issue is if you have a booster now, will you be able to have a booster to the new variant that they are trying to cover? So it's really quite undecided at this point, and I think for a lot of people it's just been a personal decision if you qualify for it. But what we're looking at with some of the things that are coming is it may get a lot worse. This one is really affecting people in other countries in a very negative way. So we certainly should not be being complacent about it. So that's one thing. One of the other things that comes with COVID is there's a couple different numbers that, they change all the time. The confirmed COVID count is stated at 555 million, but realistically it's thought to be double or triple because at the beginning there was no testing, and that's in the world. And a lot of people were dying, were being diagnosed with pneumonia or something along that line. So, that's a staggering number. When you think about the fact it's just continuing on, the numbers are still high. But people, if they're going to test at home, they just aren't reporting. The other thing that has come out of this that I was just looking at today is there is two other things that have come with COVID. One is long COVID. And when we talked about the fact that it's not that important if you're just off for 5 days, etc., etc. But there is some evidence coming out that the more often you get COVID, the more likely you may be to develop long-term COVID or long COVID. And that can be devastating for people. There's such a nobody even really totally completely understands what long COVID is. But we know that there are certainly enough people with symptoms in the same pattern that we know it exists. And that's another reason to, again, not underestimate the whole thing about COVID. Just because you're not very sick doesn't mean you can't develop some of these long-term symptoms. So again, protection, protection. Something else that had come out that is a little bit off to the side, but there is another side effect of COVID that they're discovering is that since COVID has been, the opioid deaths have increased by 39% between 2019 and 2020, which is just staggering. I mean, the numbers are horrible, and they're continuing to stay high like that. They think one of the counties that I was looking at right now, the death rate is of people that are dying is 44% are because of opioid overdoses, primarily associated with fentanyl. But there was just a huge jump as soon as COVID came along. So again, people aren't completely sure what all is causing it. Is it because now you're home and you don't have any money, but you've got enough money to do things that you shouldn't? But the other thing is, of course, there's been this huge rise in fentanyl. So I don't know, but that was a sort of a long COVID effect that we weren't really expecting. Monkeypox, we all are hearing about monkeypox these days, and the first case was in the UK. Anybody can be infected, but the majority of cases have been seen in men who have sex with men. When I wrote this a week or two ago, there was almost 770 cases that have been reported in the United States, including in Indiana, and I'm sure there's significantly more. I forgot to look up the most recent number today, but I'm sure there's more. Vaccines are available, but there's very specific guidelines as to who can get them, and the guidelines are provided by the CDC. As people who had smallpox immunizations when they were younger, or now that are older, may also have some protection from them. So there is some debate as to whether there will be any kind of mass vaccination, particularly for people who are not at great risk and have had smallpox vaccines. That's still, again, up for debate. There are some antivirals that have been developed for the treatment of smallpox, and they're being used judiciously for monkeypox. Luckily, most people are not getting that ill for it. Again, not to minimize it, not to suggest it's not important, but there hasn't been a huge increased death rate associated with it. One more good news thing too is West Nile virus is here in the mosquitoes. My phone would not connect. I meant to look and see if there's been any new cases in Indiana besides in the mosquitoes. And do you know?
We've not had any in LaPorte County.
Yeah, that's what I meant LaPorte County, sorry. But there is West Nile in Indiana, the last, both in the human population and the mosquito population. The last thing I guess that I have to talk about is the Indiana State Department of Health has partnered with local health departments, including ours, to host back-to-school immunization clinics this summer as part of a statewide public awareness, because I think we've all heard is immunizations in general have dropped. A lot of kids were not getting their immunizations during COVID for a whole lot of different reasons. Parents didn't want to take them out, parents were sick, parents had taken enough time off for COVID, they couldn't get out. But there's a lot of kids that are not immunized, and they're hoping that this is going to be a way to get back with some of these kids on track again. Again, listening to NPR today, some areas are using the back to school get together to have people there from public health to be handing out the all the information and then doing a follow-up call the next day. I'm not sure we have staff or need to do that, but we are providing an immunization clinic, and that'll be at the LaPorte County Fairgrounds. And the dates, I can tell you the dates. It's the 29th and 30th of July and the 16th, 17th of August from 10 a.m. to 6 p.m. And I know that there's advertising going around because I've seen it to try and get people out to do that. Obviously, it's incredibly important to do this. And again, some of the schools, of course, are requiring it, that they kind of let pass a little bit through COVID because so many of the kids were being homeschooled, and hopefully they're all going to be caught up with regards to that. I think that's my report. Any questions?
Are there any questions for Dr. Ducey? If not, I will entertain a motion to accept the health officer's report.
Motion to accept.
Do I hear a second?
I second.
Any further discussion? If not, I will entertain a vote, and we have to each say our vote and our name. So let's start with Mrs. Arnold on the screen, and we'll go through the guys up there first.
I vote yes.
Dr. Dora?
Pat Dora, yes.
Okay. Go on, Dr. Cox?
Georgetta Manning Cox, yes.
Okay. Dr. Nelson?
Yes.
Okay. Ally?
Ally Lawn, yes.
Mike Sandy?
Mike Sandy, yes.
Dr. Uhas, yes. Okay. The health officer's report is accepted. Next, thank you, Dr. Ducey.
You're welcome.
Thank you. Amanda, the administrator,
Good
your
afternoon.
report.
My report. So as Doctor was saying, obviously COVID is very much here. It's not going anywhere. You can see it from our numbers that we report weekly. First quarter we started April, or second quarter, April, we started 271 positives, and then in the 800s for the next 2 months. I'm looking at the numbers for July, we're already at over 400 cases halfway through the month, so I expect us to get back up there into those numbers. And it is kind of misleading because there's so much more home testing now and self-testing that those numbers aren't being reported. So it's very difficult to try and get an idea exactly what the transmission rate is and positivity rate is within the county. But from these numbers, it's very obvious that it's still very active. So with that, we have moved our vaccine clinic. We do still have a dedicated COVID-19 vaccine clinic. It is now in the office on Wednesdays, every Wednesday. It's still by appointment. You can still make an appointment or still also walk in. We were very fortunate to be able to work with one of our community partners, Northwest Health, who housed us for over a year in the old hospital and then in the old cardiac unit at the Heritage Place. But we were seeing a massive decrease in the number of people coming in to be vaccinated, and vaccination is so widespread now, or so available everywhere. You can walk into Kroger and get a vaccination. So we weren't the only site in town anymore. Our numbers were dropping off, so we decided to finally just move it back within our office. And it still had been good turnout. Last week they had 23 people come for clinic. So, and we had people for boosters, people still coming for their very first vaccination, and we also had people come in for the pediatric doses, which brings up that we do now have pediatric doses in Pfizer. It's for 6 months to 5 years of age. So we can do anyone from 6 months and older within the office. Our testing site, at the very last minute, we were ready to close the doors on that. That was supposed to be stopped being supported by the state on the 30th of June. And then at the very last minute, literally 2 weeks before it was all supposed to come to an end, they offered more money to keep testing open. I think because they were looking at numbers and seeing that this is going to be a possibility of having more events later this year. So we took advantage of the grant money they were offering. We are doing a drive-through type clinic out of our Michigan City. They drive up, they call the number, we come out, swab them, and they're on their way. So that seems to be, we got the kinks kind of worked out of that, and it seems to be going much smoother right now. And people seem to be seeing a increase in testing, and I think a lot of it is because they don't have to get out of their vehicle and somebody's coming out to them to be tested. That's what we're picking up on. We were able to receive several grants last quarter. First one was from the Healthcare Foundation for our FEMR. We received $62,450 for the next year to get our FEMR team up and running. I am very happy to announce that we do have a FEMR coordinator, and that's our very own Peggy Rose, who is going to take that on. I'm very happy to have her in that position. She's very well respected in our community. She knows a lot of the people who will be on that team and has worked in the hospitals. And she's going to do a fabulous job of running that. When we get more into it, she will be coming to give reports at the meeting to let you know everything that's been going on with that. We also received a grant for over $95,000 from the Indiana Department of Health for lead testing. As you know, the lead levels for children have dropped, and they are anticipating an increase in our cases that we will be having to follow from just 2 or 3 a year to over 20 plus children a year. And knowing that that's going to put a burden onto the departments, they are offering grant money to help offset that. So with that money, we will be hiring, and we actually have hired a part-time nurse who will be doing nothing but lead. And we are able to have that money over the next 2 years. And then the $50,000 we received for the COVID-19 testing. We were finally able to select our MA. We went through that process, and she has started. That seems to be working out extremely well, very well. So hopefully, and we'll see. We still have our nursing position open. We still have one nursing position open, full-time position, and no applicants. So, budget hearings are coming up later this month. I plans to address that at that time to see if we can get any more money for these nursing positions so we can have a full nursing staff and then compensate our nurses respectfully what they should be getting paid. Or we have options out there, maybe possibly. We really do need another nursing position, but with the MA position right now working out, maybe it's still too early to see how well it's working. So maybe I'll put that on the back burner and we'll bring that up another time. As reported last time, I was selected to serve on a committee with the state to rewrite the septic code. As you know, House Bill 1245 passed. It's part of it went into effect July 1st of this year. The second part goes into effect of July 1st of 2023. And the part in 2023 is when home rule is removed from the septic code. So all of our ordinances become void at that time. So our regular septic ordinance, our operating maintenance program, and our property transfer ordinances are gone. So the state, we were given an opportunity to rewrite the code to hopefully address some of the issues that were brought up and why this all came about in the first place. A committee was formed to rewrite the code. There's 15 members that work for local health departments, and then also members from the state, and then the state legal council. Excuse me. We started by putting out an email requesting all the ordinances, policies out there from every single county to please submit them to us. We could go through them and see what was different in their ordinances that was different from the county. And then their ordinances, it was different from the state code, and what made them more restrictive. And starting there, taking that and trying to put as much as we can into the state code to hopefully cover everything that could possibly come up as an issue. And we have literally started at line 1 and went through all the definitions in every single line of code and have rewritten it. We're at a place right now, we just had a meeting, our latest meeting, and we're at the point of just getting it in the proper format so we can submit it back to the state for promulgation, for hopefully not to be torn apart. And we can salvage as much of it as possible. It's been very interesting. It's been an honor to be able to serve on that committee, to be selected, honestly, and to be able to have input in all of that process. There's hopefully, it'll be interesting to see what actually we're able to get passed in that code. But there will be a new septic code next year, 99% sure. Yeah, we almost have a final draft. It'll be submitted soon. It gets doled out to different entities to have their input over it, and we will see where it all falls in the end. So if anybody has any questions, I'll try to answer them the best I can. I'll just make it up. No, I'm joking. Sorry. Just see if you're all paying attention.
So do we need to make any changes in our current policy about the septic, say, in Long Beach? And if people want something done now? Because the underlying reason for the septic change was going to be sewers in Long Beach.
Correct.
And now there doesn't appear to be that there will be sewers.
Right, there doesn't appear at this time that there's going to be any sewers in Long Beach in anytime
So
soon.
if that's fair to say, but we still have the no, and again, correct me if I'm not correct me if I'm not understanding. We still have the no new septics and no repair of septics in place for Long Beach.
Correct. The board still has the moratorium in place for Lakeshore Drive.
And I suppose around January, a whole new thing, or code will come from this downstate.
Yeah, hopefully that's not going to affect that area
So
as far as sewers are concerned.
I guess what I'm trying to get to and stumbling along is, do we need to do something about the moratorium now that there's no sewers? Because what about the folks on Lakeshore Drive who have problems with their septic?
Right. I don't know if you wanted me to talk about that now, or did you want to talk about that in new business?
Okay, we could do that. That would
Okay.
be fine.
Yeah.
Wherever you want, but just everybody kind of think about it, because we're going to have to deal with it, I think.
Yeah, I think, it's going to be a longer
Okay,
discussion
all right.
here in a sec.
So that's fine. Anything else for us from your report?
No, ma'am.
Okay. Is there a motion to accept the administrator's report?
I move we accept the administrator's report.
Is
I'll second
there,
it.
all right. And is there any discussion? If not, I'll entertain a vote. Let's just go down the list, you guys, and say your name.
Mike Sandy, yes.
Ally Lawn, yes.
Lauren Arnold, yes.
Mark Nelson.
Pat Durrell, yes.
Okay. Dr. Cox, we can't hear you. Okay. Your mic's not on, ma'am.
Muted.
I'm sorry.
There you go.
Georgetta, yes.
Okay, give us your vote, ma'am.
Yes.
Okay, thank you. Dr. Nelson?
Mark Nelson, yes.
Okay, and Dr. Uhas, yes. And the report is accepted. Next on the item on the agenda is Director of Environmental Health and Foods.
Good afternoon. Can you hear me? Okay.
Yeah.
The first thing on my list is the interns that we have hired for the summer for the beach sampling, and everything is going great with them. We have two, Sam and Lexi. They are students at Purdue University. They're doing the beach samples every day, 13 inland samples twice a week, and the 6 Lake Michigan samples 3 times a week. We have had 15 advisories so far this summer with the beach sampling. They have also been organizing different things for each department, and they've been also delivering COVID tests throughout the county. They will be with us until August 18th, will be their last day. The water lab, quite a few samples. The 656 samples were analyzed in the water lab in the second quarter. We had 138 permits, septic permits that were issued, 61 well permits that were issued, and 186 property transfers that were completed. We also had 81 compliance letters that were sent for septic. After the property transfers are done, if we have issues with them, then we send out compliance letters. We had 81. The new employee that we are training to do septic inspections is almost ready to go, so that's going to be a big help for us. We had 36 environmental complaints that were completed. With the food division, we had 69 temporary permits that were issued, 360 regular inspections that were done, and 15 new establishments. We had one hearing for excessive violations, one establishment that was brought in for a hearing, excessive violations, and a possible foodborne outbreak. The health educator who was put under my supervision, I don't know, like 3 or 4 weeks ago. So I'm reporting for that position too now. 2 trainings for Narcan. She did 3 health fairs and 11 car seats that were installed. Anybody have any questions?
I do. A couple of things. First of all, how'd the fair go and how do your inspections go?
The fair went fairly smoothly. We did have one establishment we did have to close because it was really, really bad. It was hit and miss. We had places that were problems throughout the fair, but then they knew we were spot checking them on a regular basis, so it was pretty good towards the end. There were 46 temporary establishments, food establishments that we inspected. We initially inspected the 46, and then we did about between 20 and 30 spot checks every day. And we had 3 mobile that have mobile permits with us that got their regular inspections also.
And my second question is, I believe I probably asked this before, is I see you're doing your seasonal pool inspections.
Yep.
What do we do with the splash pads that are around? We have both private and we have public, we have government and we have private splash pads. Are they inspected? That water is recirculating, and you know the age of the children that are there and the diapers and stuff, and they're going to get that in their mouth, and it's recirculated water. What are we doing there?
The splash pad in Michigan City is not operating.
Well, we got one, 2, 3 in LaPorte.
Yeah, those do not recirculate.
They don't.
Nope.
That goes right into.
They're not permitted. They do not recirculate, so they're not regulated at all.
And what about Michigan City's closed down, or?
Yeah, they closed it. They were talking about reopening it, but not recirculating. So they were going to change out all their equipment, but that has not happened yet.
Is there a ordinance covering them at all?
Yeah, the pool ordinance covers splash pads.
That's a question somebody asked me, and that's all the questions I have.
Thank you.
You're
Thank
welcome.
you, yeah, a lot of work. Any other questions? If not, I'll entertain a motion to accept the report.
So moved.
Okay, who's second?
Dr. Nelson seconds.
Okay, thank you. And no further discussion. Ellie, did you vote on that? Accepting?
No, I didn't vote, but Ally, Lon, yes, yes.
Mike Sandy, yes.
Dr. Uhas, yes. All right,
Lauren
thank you.
Arnold, yes.
Pat Doral, yes.
Very good.
Yes.
Okay. Dr. Cox was a yes. All right, very good. Next item is the Director of Nursing report. Jennifer Smith.
Good
all right.
afternoon. As everyone has discussed, we have seen an uptick in the COVID-related inquiries in our office about isolation and quarantine, so we know it is still out there. The public is calling our office, wondering how long they need to stay in isolation, or asking when they're exposed how long they need to be in quarantine. So I can say yes, the cases are increasing in this quarter. We participated in a family fun fair at the Lake Hill School this quarter. We did a general nursing services table, and we had handouts and giveaways. We did resume our immunization services in our Michigan City office in June. That clinic is held on Tuesdays, and now all the clinics that are available in LaPorte are now available in the new Michigan City office. And that clinic has been full every week, so they are learning that it's open again, and they are making appointments to come in, which is great. There was some sequencing data available from the state, but it has not been out in a while. They were very good about weekly updates with that, but I haven't had an update in quite some time. But that's in my report of the lineages that were identified. Omicron, they only said 2 cases. Well, they're not testing every sample. They do them at random. So, and like I said, we haven't had one in quite a while. So this is old data. But Omicron was starting to make a presence. I did attend the Child Fatality Review Team meeting in June. It was via Zoom. We released the 2021 annual report, and included in that were the summary of the 6 cases we reviewed in 2021. We didn't have any cases up for review at that time, but there have been a couple since, and we're supposed to be meeting in late July or the first part of August to discuss those. We had a surprise shipment of 1,320 bottles of prenatal vitamins at our office. Kind of knew they may be coming at some point, but wasn't sure when. So I worked with the local agencies in our community to distribute those, and our interns were very helpful in getting those out. They hand delivered those to the agencies. But we partnered with HealthLink, the Women's Care Centers in both LaPorte and Michigan City, the Franciscan OB Physician Group, the Northwest Health OB Physician Group, and Dr. O'Valley. And we also kept a small supply at our office in case anyone would need those. A little bit about monkeypox. As Dr. Ducey was speaking about earlier, there have been several countries that don't normally report monkeypox that have started reporting monkeypox. And the CDC is just urging everyone to be alert for patients who have rash illnesses, regardless of whether they have travel or specific risk factors. We currently don't have any cases or contacts in LaPorte County, but there are 11 cases in Indiana right now. We provided 621 vaccinations to 327 clients in the second quarter. We saw 50 clients for laboratory services, 36 clients for international travel immunizations, 63 communicable disease investigations, 103 tuberculosis tests, and we saw 8 clients in our confidential services clinics. We did 4 lead tests and did 1 home visit for an elevated blood lead level. We also provided 9 cribs and did 9 safe sleep education classes for those in need. Any questions?
Any questions from the board? Okay, if not, do I hear a motion to accept nursing supervisor report?
I move to accept Jennifer's report.
Okay. It was Lauren Arnold who.
Yes, Lauren
A
Arnold.
second, yeah. Is there a second?
I'll second that.
Okay. Any further discussion? If not, I'll entertain a vote. Just say your name and your vote.
Mike Sandy, yes.
Ally Lon, yes.
Georgetta Cox, yes.
Lauren Arnold, yes.
Mark Nelson, yes.
Dr. Dora? I couldn't hear that. I think it was a yes, but...
Pat Doral, yes.
All right, thank you. Dr. Uhas, yes. So the report is accepted. The next item on our agenda is the attorney's report.
Thank you, Doctor. I don't have much to report. A lot of my comments are going to come under the new business discussion. The only comments that I have is we do have one pending litigation case that's hopefully going to be resolved in August. We filed our complaint earlier, and court set our hearing for August. It's a issue regarding a septic issue, and hopefully it'll be resolved then. I also attended Indiana State Health Department CLE, continuing legal education course, and got some general updates regarding a lot of the issues that we deal with. We were hoping to get more information regarding this new House Bill 1245, but there just wasn't that much information shared. I think it's so new that everyone's still kind of feeling it all out, you know, how it's gonna play out. So we didn't get that much information from them regarding that, but it was generally a good meeting with some with a lot of the surrounding counties participating. So we got to hear a lot of issues that other people are dealing with as well, and they're not much different than ours, quite frankly. So that's my report. If anyone has any questions, happy to answer them. But I have a lot more comments regarding the discussion under new business.
Yeah, we're going to get to that, as Amanda said. So, does anybody have any questions from Mr. Okay. Somebody to make a motion to accept the attorney's report.
I so move.
I'll second that motion.
Okay. Everybody register your vote by name and A or nay.
Mike Sandy, yes.
Ally Lon, yes.
Ms. Arnold?
Georgetta, yes.
Lauren Arnold, yes.
Pat Doral, yes.
Mark Nelson, yes.
Dr. Uhas, yes. All right. The attorney's report is accepted. Old business. Do we have anything that anybody wants to bring up in old business? I do not. Amanda, you guys have anything from the health department? No? Okay.
No, doctor.
All right. Then, in that case, time to move on to new business, where we will discuss lifting the moratorium of the septic systems on Lakeshore Drive in Long Beach.
Would you like me to start with that, doctor?
I'm sorry, say that?
Would you like me to start on that?
I would appreciate that.
Okay.
Yeah.
So, where to start? So House Bill 1245, or House and Road Act 1245 now, as we know, is going to, there's several different sections to it. It's confusing on what started this year on July 1st and what starts next year, July 1st. But July 1st, 2023, everything goes away. Our moratorium is gone. Our septic ordinances are gone. We can no longer be more restrictive than the state. We're also now in 1245 that went in effect the first of the year, that if somebody applies for a septic system and we reject it, saying no, this doesn't meet code, we're not going to allow you to build, they can hire a professional engineer, a soil scientist, and an installer, and that they all three agree that it does meet code. By law, whether we agree that it does or not, we have to issue a permit. So those are the issues with 1245. The other items with Long Beach, on the north side, on the lake side of Lakeshore Drive, when the moratorium first went into place The board put that in place because the lake levels were so high with all of the storms that were coming through, basically attacking the shoreline. We had septic systems that were being washed into the lake. It was hoped that so the board put on the moratorium, so septics couldn't be repaired or installed, or new installations, hoping that a solution would come about. And one of those hopes was that it was going to be sewer. And as we all know, 1245 and helped kill the sewer bill, and also the sewer project itself in Michigan City, not in Michigan City, in Long Beach. And their plan was to use Michigan City Sanitary District, and that the city council just vetoed that. So that has essentially killed any hope of sewer currently for Lakeshore Drive. So now I have a situation where we have homes, we currently have 14 homes that are on pump and haul, that don't have a hope of connecting to sewer now, and would like to have a functioning septic system or a septic system, so they don't have to continually pump and haul. We currently can't do that because of the moratorium. So there's a lot of different layers to this. So right now, if they do apply for a septic permit and it does meet our code, House and Road Act 1245, if they have a private engineer, installer, soil scientist, we have to issue a permit anyway, regardless of the moratorium. So at this time, as we're asking the board to look at, to consider or discuss amongst yourselves, whether now is the time to go ahead and lift that moratorium. And I know Nelson, I'm gonna let him.
Thank that. You did a great job of explaining that. That was really good, because it is pretty complicated. The problem with the moratorium is that with this new House Bill 1245, it strips away the power of the moratorium, basically. If someone were to come in and apply and seek a permit, and the health department denies it, they can go through those steps of having those three professional engineer, installer, and soil scientist, and the statute says that then we have to issue them the permit, and that's effective July 1st of 2022. So I guess the question is, what is the reason then to have the moratorium? Legally speaking, you can have it until 2023, because that's the next section that applies to this whole rule. You can't have a more restrictive rule or ordinance than what's already enacted or what's already on the books. And so therefore, at that point, the moratorium would be void because it is more restrictive. So the question then becomes: is do we do it now? Or is there a reason to continue to have it on the books? As we have it now, even though individuals can apply and eventually get their permit if they seek out the three individuals that the statute dictates. But technically speaking, you can still have the moratorium for now, because the rule doesn't go into effect until July of 2023. That section of it. So then that's why we wanted to put it on the agenda, to open it up for discussion and have everyone, understand what it is that we're talking about here. As Amanda said, I think there are individuals in that area that probably would like some answers or would like to have this addressed, so that they know how to proceed. And then also, because all of this is so new and we have no guidance, we do need to also a little bit of time to coordinate and figure out how it is that we're going to address some of these concerns. But as far as the House Rule 1245 goes, it's our recommendation that the moratorium be lifted, just because it doesn't really serve a purpose anymore, given the fact that if someone were to apply and then that permit is denied by the health department, they have a mechanism of being approved that the statute indicates, and so therefore the moratorium doesn't really even have its power anymore. So that, just wanted to give you an oversight. If there are any questions, happy to answer them, and we'll do the best we can to answer them because, like I said, it is, no one has the answers yet, right? I mean, luckily, you know, I think this is something that the board should know. Amanda's on this committee setting this up, so she has a lot of knowledge, and I'm glad because, you know, it's pretty complicated, and so it's nice to have someone on our staff, our director, who was involved in this.
Does anybody have any questions for Nelson or for Amanda, or comments, or just questions in general about this topic?
I do.
Yeah, go ahead, Mr. Sandy.
If we lift them, and what kind of standards do they have to meet then? I mean, putting it in that's...
So they still have to meet this Indiana State Code. They still have to meet the 410 rule. The 410 IAC 6-8.3.
And do you believe they can meet that on the lakeside?
Not every property, no. And it's the same properties that couldn't meet it before, so there's not going to be any new properties that can't meet it. It's the same ones before.
So what are we gaining? Nothing, right?
So then that becomes, that's the dilemma, right? Because then if we disagree with them, if the health department disagrees with them and doesn't issue the permit, they can go out and seek their own experts.
And they can do that if we lift it or don't lift it.
Right. And so then
So personally, I would leave it on, make them do that, now in my opinion, and make them go through that extra hoop, because we don't think it's safe. That's why we put it on to start with.
Yeah, the only thing, and that's correct, the only thing is we would still have to issue that permit if they do meet those three professionals and provide that to the health department.
Yeah, we understand. I mean, I understand, so.
So even if we kept the moratorium come January, those properties we're talking about, if we said, no, you don't get a permit, come January, when the second part of this rule kicks in, they can just, you know, thank you very much for your input, and issue a permit, or tell us to issue a permit. I'm hearing that the moratorium at this point doesn't seem practical because it doesn't have like a consistent force.
Right.
And I want to be sure, because of the health department's mission for public health and safety, that we, and also unhappy homeowners who have problems and are tired of pump and haul and are tired of septics that aren't, you know, working. You know, we need to get some kind of common sense solution here, because the state is eventually going to give the overarching law or code.
Yeah.
So I know I'm kind of jumping ahead. I wanted to hear everybody else, but I'm thinking at this time, end the moratorium, follow Indiana code that Amanda knows, and mention the two codes for their, and they still this is what, and I'm going to just take a moment, this is what Chief Marshal Swistek at Long Beach, our police chief, wrote just the other day, I guess. He sent this to our homeowners, and he worked on it with Amanda, so it wasn't just something, you know, police officer wrote. This guy knows what he's talking about. He talked to Amanda, and I have a copy of this. This went out to the Lakeshore Drive homeowners. Department has informed us that they will accept applications for septic systems on Lakeshore Drive, and they will review on a case-by-case basis. Homeowners will be required to complete an on-site residential application and submit a soil report from IRSS licensed soil scientist. The health department has available a list of certified soil scientists. Additionally, if the septic system will be placed within the 200 feet of the ordinary high water mark, the system will require a secondary treatment system known as an Advanced Treatment Unit, ATU, and approval from the Indiana Department of Health before a permit. So it goes to them. So the Indiana Department of Health, before a permit is issued. And attached with this letter is the health department procedures and for the issuance of an on-site sewage system. I guess what it's saying is it opens discussion with the community. If they do the proper paperwork to get this done, they should be able to have some kind of remedy for their waste disposal. So that's kind of how I'm looking at it. I think we're just forestalling the inevitable if we lift them more. And just in case anybody thinks, well, we can't make up our mind, I will echo what Amanda said. When this moratorium was passed, I remember it very well. Lakeshore Drive was at risk for falling into Lake Michigan. If you walked down Long Beach, you could pass exposed septic pipes on the beach. And the lake was pounding homes over seawalls. So we're not exactly like, oh gee, we just thought we'd pass a moratorium, now we had a good reason. I'll tell you now, with the drought and the hot summer, the lake is no longer in that same position. With this one caveat from us, is this. We recognize full well that lake levels are cyclic. They cycle. So I'm not saying if somebody buys a new septic system with a permit and then 4 years from now the waves are pounding it again, we can't control nature. But at this point in time, the lake is a lot lower than it was when the moratorium was instituted. So that's kind of the other reason why I think it doesn't really hold up for the people that needs to have something done. And now that we don't have sewers coming, they need a remedy. Okay, that's it for me for now. Anybody else, please?
Doctor, just a couple notes there. You mentioned the date January 1st.
Yeah.
The section 12 that would have the moratorium ended is actually July 1st of 2023.
Okay,
So
thank you.
just so that's
Okay.
clarified there.
All right, good.
And you're absolutely right. I think the board, when it made its decision regarding the moratorium, was on point with that decision being made. The other thing that we can't control though either is how the legislator enacts their laws and things and what they want us to do, right? So if that's their decision and that's what has been voted on, again, the moratorium basically loses its teeth and there isn't anything that we can do about that because of the fact that they can seek out their permit in a different way. So I think you're absolutely right.
I think times change. I know downstate they're doing the best they can for public health and safety. We kind of have to sit back and let them finalize what they want to do. But right now we need to act because there are people on the lakefront that have septics that are not properly working. Does anybody else have any other comments on this? Because I think we could possibly do one of two things today: either entertain a vote to end the moratorium, or table it and think about it for another 3 months. I'm open to suggestions here. So the first thing I want to know is, anybody else have any other comments? I know I blabbed a lot, but no. Okay, I don't see anybody raising their hand. Miss Dr. Nelson, did you raise your hand? No? Okay.
I kind of fall to Lauren's expertise on this. I don't know how bad these systems are in Long Beach, given the state standards. Are they going to be able to pass? It sounds like several of them are not. So if we lift the moratorium, they're still going to have these questionable things. They're still going to need to pump and dump type stuff. They're not going to be able to get a septic system. And then the other ones that probably could. So I guess my feeling is it's okay to lift the moratorium. It's not like the state standards are so low they're going to have sewage washing up on our beaches. Is that correct?
I think you hit the nail on the head when you said, look, we're going to do this case by case. So you're right. Some of them are not going to qualify. So I think, and as the chief's letter to the homeowners said, it's case by case. But up till now, it's been, we haven't been able to entertain any discussion because of the moratorium. And I think the moratorium at this point has served its purpose. And we're going to have to adapt, because not only are we trying to manage things here locally, on the ground, knowing what the situation is at the beach, but also then be prepared for what they do downstate, which is exactly what they're supposed to do, their job. It's their prerogative. Amanda? No comment?
I could comment all day long on this and on septics, but yeah, I mean, right now with the procedures that Chief Swistick is talking about are the procedures for every septic system in the county. So there's nothing special there except for that 50-foot separation distance from the lake requiring the ATU. That is in the state code though, so that's not anything special. And by statute, any septic system with the ATU has to be reviewed by the Indiana Department of Health. So we're not putting anything more stringent than what state code is. But you're right, there are properties out there that will not be able to get a septic system on that will meet state code.
Right, and again, you know, if we deny that permit, say that whatever reason, because of the state code, they still have the opportunity to find their own soil scientists, find their professional engineer, find their installer, and if they say this is okay, then by law, by 1245.
That's right. I mean, that's how things work, and you know, it will be also on the state if they get a permit and we say no, and they just, you know, then we can't. They're above us.
Absolutely. And obviously, the recommendation is that this board follow, 1245. It's
yeah. We're kind of just trying to figure out how to fit in with existing legal policies in the state of Indiana, at the same time being fully cognizant and vigilant, and wanting to protect the people of the state and the lakefront. But you know, this is where we're at today.
Right. And again, this was the board's moratorium. You're our boss, and we're going. You are. I saying to leave it in place. You know, we'll have to leave it in place and deal with it. But like you said, it just doesn't have teeth anymore.
No, I mean yeah. So, anybody else? Because I'm kind of speechifying here, as Mark Twain would say, and I'm not sure I'm adding anything to this at this point. I've said it all. So,
given all that, Mark Nelson here. I would like to make a motion to lift the moratorium.
Well, I couldn't hear him.
He's making a motion to lift the moratorium.
Okay, all right. So we have a motion on the table. Is there a second?
Second motion.
Say again, Dr. Dorr?
Yes, second.
Okay, so we have a second. Now the motion is on the table. Everyone please register your vote and say it with your name first so we know who's voting where. So Mike Sandy, go ahead.
Mike Sandy, no.
Ally Lawn, no.
Lauren Arnold, no.
Ty.
Georgetta Manning Cox, no.
Dr. Cox, no?
No.
Okay, I couldn't hear you. Ms. Arnold?
No.
Okay, and Dr. Dory, you said no?
I said yes.
You said yes. I say yes too. So the noes have it. Right?
Right.
Yep. So I think what we'll do with this issue then, and that's how it works, people vote and you don't always win, but we could bring this up again in October if something changes. In other words, we still have a reaction on the ground we're going to get from the homeowners, I suspect.
We can bring anything up at the next meeting. I mean, it wasn't tabled, it was voted no, so somebody has to make a new business and bring it up.
So yes, that's correct. My point is that this is going to be an evolving situation, I suspect. Okay. And I don't have any other, that's the one bit of new business. So does anybody have anything else for new business? If not, we need to pick a date for October. I don't see anyone on the screen indicating new business. October 11th? Does that work for people?
It works for me.
October 11th, Tuesday, 4 p.m. again?
Yeah. Dr. Nelson, is that good for you as far as you know?
That looks to be good for me, yes.
Okay.
Yes.
That's fine. Dr. Dora, Mr. Sandy, Dr. Cox.
Yes.
We're good. And Miss Arnold, we're good. So 4 p.m. we'll be here. All right. If there is no further business, then I will adjourn this meeting.